is called a CBC, which stands for Complete Blood Count. Okay. Last class we mentioned the fact that a CBC will provide quantification with respect to the number of red blood cells, white blood cells, and platelets. Okay. It quantifies the number of red blood cells in 3 different ways. The CBC provides a red blood count, okay, which is the number of red blood cells per certain volume of blood. It also provides information with regard to hemoglobin concentration, the concentration of hemoglobin within the bloodstream in units of grams per deciliter. And then the third way is by providing an hematocrit. And hematocrit is the percentage of red blood cells within a certain volume of blood. And of course, these 3 measurements should correlate. If someone's anemic, all 3 numbers should be low, reflecting the fact that they have a decrease in the number of red blood cells that are circulating. Now, if I order a CBC stat, what does that mean? Right, what does it mean?
As quickly as possible.
What's that? Yeah, complete blood count. If I order a stat, what does stat mean?
Immediately?
Right away, yeah, immediately. But even if I order a CBC stat, it may take the lab maybe 15 minutes to get a report back to me. Sometimes you'll work on a unit where you need more immediacy. You need to get results quicker. So one thing you can do is what's called a spun crit. This one doesn't work. A spun crit, C-R-I-T, is really simply an abbreviation for a spun hematocrit. Okay. Now, we can do this at bedside. When I used to work, when I was a resident, no, I'll go back. When I was a medical student on OBGYN, because women would come in labor and we needed to get information rapidly, we would do a spun crit at bedside to find out what their blood counts look like. Now, with the spun crit, what you do is you draw blood within your standard purple top tube. We talked about the purple top tube.
Yes.
In fact, it's got a reagent.
Has a little stuff at the bottom.
Yeah, you'll see a little clear fluid at the bottom. So when you draw the blood, then you kind of invert the tube so that it fixes. Well, I'm going to take that blood then, and I'm going to pour it into a very, very thin tube called a capillary tube. Okay? And this capillary tube is calibrated. 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. And we can think of these calibrations in percentage units. So that now I'm going to pour some of this blood into the capillary tube up to 100 here. Okay. Then I'm going to take that capillary tube and centrifuge it. I'm going to spin it down using a special centrifuge for capillary tubes. And after I spin it down, it's going to separate the formed elements from the plasma. Okay? So for instance, I may see a meniscus here that separates the red blood cells below from the plasma above. So this would be plasma. And this would be red blood cells down here. Okay. And then I can look at the calibrations alongside this meniscus, and I simply read the number. This might be 45, which means that red blood cells make up 45% of the volume of this blood. Okay. In other words, this blood is 45% red blood cells by volume. So that tells me this patient has an hematocrit of 45%. Easy breezy, right? Okay.
And what's
So-
the smaller tube called?
It's called a capillary tube. capillary tube. Okay. So when you look at the CBC, you're going to read the white blood count, the red blood count, hemoglobin, hematocrit. The CBC is going to provide red blood cell indices. Okay. These indices provide information with regard to the individual red blood cells, the average red blood cell. Okay? For instance, MCV refers to mean cell volume, which is a reflection of the average cell size. So if someone has an iron deficiency anemia, what we referred to last class as a microcytic hypochromic anemia, the cells are going to be small. So this measurement, this MCV, this average volume, is going to be lower than normal range. So a microcytic anemia is going to correlate with a decreased MCV. Now these next two indices stand for mean cell hemoglobin and mean cell hemoglobin concentration. And basically, they reflect information about the amount of hemoglobin within each cell. If somebody has a hypochromic anemia, then they have less hemoglobin than would be expected for the volume within that red blood cell. So these indices would be low if their anemia was hypochromic. And in fact, when you looked at the cells under the microscope, they would appear unusually pale. That central zone of pallor would be expanded. Everybody good? Now, when you get to RDW, you're going to ignore that. Okay? Most physicians, I know what it means, but most physicians don't, except for hematologists or oncologists. Most other physicians really don't use that information. So unless you're talking to a hematologist, oncologist, you're not going to even report that. And then platelet count.
So Dr. Penner, can you find those values after doing the spun crit?
The spun crit is only going to give you this information.
Okay.
The hematocrit. A lot of times, if we order a stat CBC and the nurse has called it back to the physician, she'll go through the entire list here. But the truth is, if he's doing a CBC just to determine how much blood the patient's lost, he's only interested in the hemoglobin and hematocrit. These are the numbers we use most frequently in the clinical setting. Now, we can use red blood cell count, but we don't. By tradition, we focus on hemoglobin and hematocrit. Now, the normal values for any of these measurements are going to vary depending upon the lab. But in general, hemoglobin values are going to vary from 12 to 15 grams per deciliter. There's going to be some variation in that normal range depending upon the lab. And what you'll find is hematocrits, okay, their range is going to vary somewhere between 36 and 45%. There will be a little bit, the normal range will be higher in males, a little bit lower in females. And that's because androgens, testosterone, stimulate red blood cell production.
So these are the normal ranges.
Those are normal ranges.
Okay.
Now, you'll notice something that's kind of cray-cray. The hematocrit looks like it's about 3 times the hemoglobin. So, at one point I had worked in a pathology lab, and one of the first things we learned when we were performing CBCs is that when these values come out of the Coulter counter, the machine that performs the CBCs, always check hematocrit against hemoglobin. It should be roughly about 3 times the hemoglobin. And if it's not, then redo the test. It's not going to be exactly 3 times, but close. Okay. So now, if I suspect someone of being anemic and I perform a CBC, and the hemoglobin and hematocrit are low, what that does is it simply confirms that that patient has an anemia. It doesn't tell me why. Okay? Those answers are yet to be divined. We would have to do additional tests. Okay. Now, a CBC, we said it provides information with regard to the white blood count. It will also provide what's called a white blood cell differential. A differential is just a breakdown of the percentage of the different types of white blood cells. For instance, the report will tell me that perhaps 60% of the white blood cells are neutrophils, perhaps 25% are lymphocytes, and 5% are monocytes, and then another 3% are eosinophils, and 2% are basophils. So it will give you the breakdown in terms of percentages of the types of white blood cells. We call that a white blood cell differential. Now, if the CBC is markedly abnormal, or if the physician requests, then the pathologist will review the smear. Okay? And when the pathologist reviews the smear, he looks at the red blood cells that have been stained by a specific type of stain called a Wright stain. Okay? And we looked at a smear, a Wright stain smear of red blood cells last class. And then he's going to provide a description of the red blood cell morphology. We might say that the red blood cells appear normal. Okay? You may say they look normochromic, normocytic. This means that normocytic means they're normal in size. You know, we said the average red blood cell should be about 7.5 microns in diameter. And normochromic means they appear normal in color. You know, they have an appropriate zone of pallor in the center, but otherwise they appear normal, which should equate with a normal mean cell hemoglobin and mean cell hemoglobin concentration. Now, let's suppose that that patient has an anemia due to B12 deficiency or folic acid deficiency. Last class we indicated that those were macrocytic anemias. In that case, what the pathologist would note is that a certain percentage of cells look a little bit larger than normal. Okay? Maybe not that exaggerated, but he would describe some degree of macrocytosis, and he would typically grade it from 1 to 4 plus. Macrocytosis. This is simply an indication that some of the cells look big. Okay? On the other hand, if it was an iron deficiency anemia, where you can't produce enough heme to produce sufficient quantities of hemoglobin, then the cells are going to look small. Okay? So he would describe somewhere between 1 to 4 plus microcytosis. Cells, instead of being this size, some of them are going to be like this. Okay. If the cells appear pale, reflecting the fact that the hemoglobin concentration within is low, then he will describe some degree of hypochromasia, or he'll use the term hypochromic. Okay. On the other hand, if the cells have a decreased zone of pallor, if they're packed full of hemoglobin, they appear relatively darker with less of a zone of pallor, hyperchromic. And then these two terms are used quite a bit. Anisocytosis refers to the fact that there is variation in size, that the cells do not appear uniform in terms of size, but there is some variation. Okay. Again, he could go from 1 to 4 plus. So it would not be uncommon if someone had, for instance, an iron deficiency anemia, but the pathologist could describe both microcytosis, and because there is variation in size, some of the cells being small, anisocytosis as well, hand in hand. And then finally, poikilocytosis means variation in shape. Instead of all the cells being nice and round like we like them to be, some of the cells may look like this. Or maybe this. And then you suspect, well, maybe this could be sickle cell, right? Or some other type of hemolytic anemias. Hemolytic anemias are anemias in which there's accelerated destruction of red blood cells. And that's the type of anemia that sickle cell is. These cells are prematurely removed by macrophages in the spleen. Now sometimes when those cells get stuck in the spleen, the macrophage doesn't remove the whole cell, it nips off a piece of it. So it makes it misshapen. And so those cells circulate kind of in a misshapen form. Or sickle cells themselves tend to collapse, crumple, okay, as the hemoglobin inside aggregates. So it results in, what do we call this? Poikilocytosis. Anybody ever watch the Three Stooges? Okay, you have seen the Three Stooges? Okay, okay. For some reason, and this is just my own personal mental pathology, whenever I see the word poikilocytosis, I think of the Three Stooges. And I think of, right, so it's Larry, Moe, and who's the other one? Curly. Curly's the bald-headed guy. And Curly would say something like, poikilocytosis! Yeah. You know, that's how he would say poikilocytosis. Poikilocytosis. If you're not a Three Stooges fan, that would make absolutely no sense. I'm just throwing it. You don't have to write any of that down.
You gotta record it.
All right. Now, this is simply a lab report from Zuro, okay? Just to show you how they report a CBC. Here's your white blood count, red blood cell count, hemoglobin, hematocrit. These are your indices, MCV, MCHC, MCH.